puso upang bumuo ng daigdig nilang sarili. Inihahandog ng Eagle Broadcasting Corporation ang kauna-unahang romantic drama series ng Net25. Pinagbibidahan ni Ina Asistio at Geoff Eigenman. Tampok sina AJ Mulak.
Trabaho pala siya sa hotel. Pero hindi mo nababanggit na magkakilala pala kayo.
Ariel Roses.
Akala ko ba ayaw mo na sa Olvida? Ba't parang dinalaw mo pa sila Reyna?
Tanya Gomez.
Dapat hindi ka na bumalik dito sa Olvida. Di ba sinabi ko na sa'yo? Huwag ka na magpapakita sa akin.
Sheila Marie Rodriguez.
Ginawa mo lang naman kung anong tama, di ba? Kaya wag mong pagsisisihan yun.
Ana Mabasa Mulak.
Ako to, si Abigail Garcia. Classmate tayo nung elementary.
Manolo Silayan.
Pag dumating ang panahon na yan, wala nang hahadlang sa inyong dalawa.
Giro Custodio.
Yung anak ni Mayora?
Huwag! Ano mo sumbong?
At Pauline Ann Boone.
Huli ka!
Sa espesyal na partisipasyon ni Richard Kwan.
Mula ngayon, wag mo na ako ituring, Ama. Tinatakwil na kita bilang anak! Tinatakwil na kita bilang anak!
At Miss Elizabeth Oropesa.
Ned, my guidance worked. Hindi ba gumraduate ka, top ng klase ninyo? Top-notcher ka rin sa bar. And you have become a very successful lawyer. And now, future mayor ka ng Olvida.
Malibot man ang buong daigdig, subalit hindi pa rin malilimot ang unang pag-ibig.
Habang may
Ang daigdig ko'y ikaw.
di tayo maghihiwalay.
Sa likhang direksyon ni Nestor Malgapo Jr. Sa panulat ni Bing Castro Villanueva.
Sa langit,
Sa direksyon ni Eduardo Roy Jr.
ika'y laging sa akin.
Ang daigdig ko'y ikaw. Ang bagong susubaybayan at kapapanabikang teleserye na magpapaibig at magbibigay sa atin ng inspirasyon. Tuwing Sabado, 8:08 ng gabi, dito lamang sa Net25. Magsisimula na ngayong November 28, 2020.
Pagmamahal.
Okay, saya, saya. Okay, saya, saya. Yes, yes!
Hello everyone, you are watching America. I'm Ace Ramirez coming to you from Washington. It's November 25, 2020. Tonight we have updates from several of our correspondents across North and Latin America. Thomas Likeness in Edmonton, Alberta.
For the second time this year, Alberta declaring a public health state of emergency.
Eliza Gonzalez Manglikmot in Washington.
DC joins Get Cover 2021, helping residents get insured during the COVID-19 pandemic.
May Ann Manzano Guerzon in Sicklerville, New Jersey.
New Jersey drops travel advisory metrics and additional 8 counties report school COVID-19 outbreaks.
Myla Simbulan in Swarthmore, Pennsylvania.
Additional new mitigation efforts for Pennsylvania as COVID-19 cases reach critical level.
Randy Bayuga in Parisburg.
Record number COVID-19 cases surge in Ohio. Governor Mike Dewine urges Ohioans to have a safe Thanksgiving.
Eli Austria in Pasadena, California.
Disneyland cancels their 2021 Grad Nite events due to the COVID-19 pandemic.
Texas Bureau Chief Jane Kathleen Gregorio takes us to Cancun, where she spoke to tourists and workers about why travel is essential to them. May Davila in Ciudad de Panama reports about the Panamanian government to acquire 3 million doses of COVID-19 vaccine from Pfizer and Biontech. For business news, Bobby Soriano in New York reports about YouTube suspending One American News Network for COVID misinformation, Purdue Pharma entering a guilty plea to federal charges, and the state of the U.S. economy. Plus a virtual roundtable discussion about that season you wish didn't exist. Our coverage begins now. First, an overview of today's COVID-19 numbers. According to the Coronavirus Resource Center of Johns Hopkins University in Medicine, as of 6 p.m. Eastern Time, Wednesday, November 25. The number of cases of COVID-19 reported worldwide is now more than 60,174,000. Top 3 on the list of countries with recorded cases: U.S. with 12.7 million, India with 9.2 million, and Brazil with 6.1 million. To date, more than 1,417,000 have succumbed to this virus. The U.S. leads the countries with the most number of COVID-19 related deaths with more than 261,000. Brazil is next with more than 170,000, and India has more than 134,000. The Pan American Health Organization, or PAHO, says record number of cases were reported in the Americas in the last week. Let's take a look.
Our press conference last week, more than 1.5 million cases were reported in the Americas, the highest weekly numbers since the start of the pandemic. Since our press conference last week.
Meanwhile, in anticipation of an unprecedented demand for special vials that will hold the vaccine against COVID-19, footage from German glassmaker Schott shows how the company has been working round the clock. The company, which is supplying 3/4 of the more than 100 coronavirus vaccine trials worldwide, has already delivered millions of vials.
All of the COVID-19 vaccine projects that are currently happening all over the world, and these are more than 100, 75% out of those rely on vials from Schott. And by the end of next year, we will have supplied enough vials to store 2 billion doses of a coronavirus vaccine. It is certainly going to be a stretch, but we think the goal is achievable because this product is a standardized product. The process, how we work with the pharma companies, how pharma companies work with their packaging suppliers is highly standardized. And producing these vials is something that companies like Schott, but also other, do on a daily basis millionfold. And this is why we think this goal can be achieved. We've already delivered millions of vials into these COVID-19 vaccine trials. And these include trials that you hear about in the media. If you store a liquid inside a container, any container, there is the risk of a chemical interaction between the inner surface of the container and the liquid. And if this liquid is a drug, then This could harm the efficacy of the drug, it could lead to side effects, it could eventually harm human beings.
In other news, President-elect Joe Biden on Tuesday introduced a slate of veteran diplomats and policymakers who will make up his national security and foreign policy team, saying America is back, ready to lead the world. 78-year-old Biden, at an event in his hometown of Wilmington, Delaware, presented his picks for the Secretary of State, National Security Advisor, Homeland Security Secretary, Intelligence Chief, UN Ambassador, and Climate Change Envoy. As the 6 men and women stood behind him wearing face masks on the stage of the Queen Theater, Biden said, "It is a team that will keep our country and our people safe and secure. It is a team that reflects the fact that America is back, ready to lead the world, not retreat from it."
Team meets this moment. This team behind me. They embody my core beliefs that America is strongest when it works with its allies. Collectively, this team has secured some of the most defining national security and diplomatic achievements in recent memory, made possible through decades of experience working with our partners. That's how we truly keep America safe.
Biden said that after he is inaugurated on January 20th and Donald Trump leaves the White House, the United States will, I quote, "once again sit at the head of the table, ready to confront our adversaries and not reject our allies." Pennsylvania and Nevada certified the November 3 election results on Tuesday, a day after the state of Michigan did so, a move which triggered the General Services Administration, or GSA, to launch the transition process. Avril Haines, President-elect Biden's pick for Director of National Intelligence, the first female nominee for the position, says her role in this team is one of a kind.
I will never forget that my role on this team is unique. Better than that of a policy advisor, I will represent to you, Congress, and the American public, the patriots who comprise our intelligence community. Mr. President-elect, you know that I have never shied away from speaking truth to power, and that will be my charge as Director of National Intelligence.
Alejandro Mayorkas, Biden's nominee for Director of the Department of Homeland Security, also a first for this position, says being a U.S. citizen is a source of pride for him and his parents.
The words on behalf of the United States of America meant everything to me and to my parents, whom I think of today and every day. My father and mother brought me to this country to escape communism. They cherished our democracy and were intensely proud to become United States citizens, as was I.
Now let's cross over to our friends in the north. Following a COVID-19 resurgence, Alberta declares a public health state of emergency for the second time this year. And Alberta Bureau Chief Thomas Likeness joins us tonight. Tom.
Thank you, Ace. Following record numbers of new cases of COVID-19 being reported over the past few weeks, we've told you about them. Politicians in Alberta have followed through on the advice of the healthcare sector. They've brought in new restrictions. Now, the biggest one, this is the one everybody's going to feel, a total ban on all private gatherings. What does that mean? It means we can't celebrate Lola or Lolo's birthday in our homes now. There will be no family dinners with outsiders. Alberta Premier Jason Kenney says the only people allowed in your house, the only ones who should be there, are the ones who normally live there.
Let me just be absolutely clear about this. Social gatherings are the biggest problem. Many people may think that a family dinner or get-together with friends is no big deal. It's just normal. And, you know, we don't imagine when we gather with family that people are going to be transmitting a virus like this. But it is the key reason why COVID-19 is winning. These gatherings in the home continue to be the largest source of transmission, and so they must stop now. That's why, effective immediately, No indoor social gatherings will be permitted in any setting, and outdoor social gatherings will be limited to a maximum of 10 people.
Kenny says violators face a $1,000 ticket, but he provides no details on how this will be enforced. You recall we told you the other day that in Alberta there's not a lot of appetite on the part of law enforcement to ticket scofflaws. They prefer instead to just give them a good talking to. So with the holiday season coming up, will these measures save people's celebrations, Mr. Premier?
So if we do not start to bend the curve with this latest round of measures and greater effort by Albertans, let me be blunt, we will impose stricter measures likely in about 3 weeks' time.
So I guess I wouldn't be making any plans now for big year-end celebrations. Now, other measures were introduced as well. We won't tell you about all the minutiae, just the highlights. Schools transitioning to online learning over the next couple of weeks. It'll likely be mid-January before students can get back into the classrooms. Certain types of businesses will have to close. Others, such as salons and hairstylists, well, they'll have to operate on an appointment-only basis. And many others will have to restrict the number of customers allowed on their premises at any one time. Restaurants and bars can remain open, but tables can only seat a maximum of 6 people, and they must be from the same household. So what's the public reaction to all of this? Some people love it, some hate it. Many say it just doesn't go far enough. So while we wait to see the effectiveness of these latest measures, I wish you all good health. Remember to take care of others and take care of yourselves. Stay home, stay safe, and stay tuned to Eagle News for accurate and balanced coverage of the COVID-19 pandemic and other current affairs. In Edmonton, Canada, Thomas I. likeness, Eagle News. We live in interesting times. Back to you, Ace.
Thank you, Tom. I can imagine implementing the restrictions on how many people are allowed in your home, visiting family members. How do you do that? How would the government tackle that?
I think what they'll rely on is people just calling emergency numbers, calling the police department and saying, hey, there's a big gathering just down the block. So I would think they'll pretty much rely. What they're hoping is it really doesn't come to that. But you know, and I know there's always some people, the rules just really don't apply to them because, hey, you know, I'm safe, I'm not infected, so I can have my gathering. But that is going to be a problem. Is how do you enforce that?
Exactly. Exactly. So
go ahead.
Government just waiting for the neighbors to report their neighbors having a party, having 10 people in the household. Is it the way it's going to be? Because
I can't see us having police patrolling the streets looking for violations. I mean, that's something that would happen in I don't know, in a dictatorship or something. Somehow you've got to rely on the goodwill of citizens to comply. Now, this restriction also, I might add, doesn't apply to service-based visits. Caregivers, health or child care providers, they're allowed into your house. Repair services, obviously. I had my internet upgraded yesterday. That technician was allowed in my house. But I can't invite him over for dinner, that sort of thing.
Let's see.
One thing, because outdoor gatherings of 10 are allowed, some people say, hey, I'll just invite them over. We'll have it in my backyard. Okay, but if you do that, guests are not allowed to go into your house to use the washroom, to get snacks, or to warm up. So there's no way around it. They can't come into your house.
And just the same problem. How do you monitor that? Even if you say 10 people, 8 people, 6 people are allowed, that's the number, the magic number. How do you monitor that? Well, yeah. Back to your report. With a growing number of cases, how does the healthcare system cope?
Well, we just heard from our Chief Medical Officer of Health, Dr. Dina Hinshaw, again this afternoon. She says Alberta Healthcare Services is increasing the number of acute care beds reserved for COVID patients by more than 2,000 across the province. They're going to add another 400 intensive care beds for COVID patients as well. And to achieve this, well, they're going to have to move some patients out of hospital into continuing care spaces, and there's not an overabundance of them either. And that means some non-urgent and elective surgeries are going to have to be canceled because we just can't take care of everybody. There's just not enough room at the inn, as it were.
Is that to address the current situation or in anticipation of a surge in hospitals?
Both, because we've already seen elective surgeries canceled in the two major cities in Edmonton, and there is a fear that some people fear that the day may not be far off where we may have to decide who gets care and who doesn't.
I see.
Because again, if you're taking care, if all your intensive care beds are full and you don't have any left over, what do you do for the heart attack victim, the stroke victim, the person injured in a serious car crash? Where do you put them?
That's a good point, a very good point. Well, thank you so much, Thomas Likeness from Alberta.
Thank you, Ace, and take care and enjoy your holiday.
And you as well. Thank you. When we come back, updates from our Eagle News correspondents in Washington, Ticklerville, New Jersey, and Swarthmore, Pennsylvania. This is Eagle News America. Stick with us.
It says the best defense is still containment.
We are in uncharted territory.
Pfizer volume 450. FI on to 100%. Traffic by. Consumption
Sila ang mga kinikilalang bayaning may mahalagang papel para makamit ang kalayaan at pagbabago sa Pilipinas. Pero sa panahong ito, may mga bagong bayaning nakikipaglaban sa sakit na lumaganap sa buong daigdig, ang COVID-19. Ang ating mga frontliner, gaya ng healthcare workers, mga doktor, nurses, medical technologists, at iba pang health professionals, mga pulis, sundalo, security guards, mga tauhan na nangangalaga sa seguridad at mahahalagang pangangailangan ng bawat komunidad. Ang mga bagong bayani, ating pasalamatan. Kilalanin ang kanilang sakripisyo at serbisyo para sa lahat.
You're watching Eagle News America. I'm Ace Ramirez in Washington. Facing a resurgence of COVID-19, leaders of the nation are collaborating on how to make the impact of the pandemic less catastrophic than anticipated. Washington, D.C. Mayor Muriel Bowser announces that the district has joined Get Covered 2021, a nationwide initiative to help residents get insured during this pandemic. In Washington, Eliza Gonzalez Manglikmut is with us this evening.
Thanks, Ace. The District of Columbia, as you've mentioned, has joined Get Covered 2021. Now, what is this? Get Covered 2021 is a national initiative to, number one, get uninsured Americans covered, and number two, promote information about quality, affordable health plans and premium reductions. Now, DC Mayor Muriel Bowser and the DC Health Benefit Exchange Authority encouraged residents of the district to sign up for high-quality and affordable health insurance at dchealthlink.com. Now, open enrollment for district residents runs through January 31st of next year. But if you are looking at coverage to be effective January 1, then you must enroll by the 15th of December of this year. Now, along with 14 states and an array of providers, patient and consumer groups, the DC Health Benefit Exchange Authority, that is the District of Columbia's Affordable Care Act Health Insurance Marketplace, joined Get Covered 2021 to promote ways for residents to get health insurance amid the COVID-19 pandemic. Now, consumers can get connected directly to the Affordable Care Act Marketplace in their state to learn about their coverage options and enroll at getcovered2021.org. In Washington, Eliza Gonzalez, Manglikmot, Eagle News. We live in interesting times. Back to you, Ace.
Thanks, Eliza. How many DC residents will this health initiative help?
Ace, the mayor's announcement mentioned that although the district has the second lowest uninsured rate in the nation, that's over 96% of district residents are covered health insurance-wise. The focus of the campaign is to make sure that every resident gets covered. So there's still that 4% that has no health insurance. Now, Mayor Bowser said the pandemic has placed a renewed focus on the importance of knocking down barriers to high-quality health care and getting everyone in the community covered. Plus, this open enrollment period is a chance also for all residents to get covered, or if they already are covered by another provider, this is a chance or an opportunity for them to find an even better plan. Ace?
That's a good program. I can see that there is a lower rate. There's a push for greater coverage. There's a push for lower rates. But I understand that DC has joined 14 other states in this initiative. What other states are participating?
Ace, there's California, there's Colorado, Connecticut, Kentucky, Maine, Maryland, Massachusetts, Minnesota, Nevada, New Jersey, Oregon, Rhode Island, Vermont, and Washington State. Now, aside from these states, Get Covered 2021 also has dozens of coalition partners. For the list of that, visit getcovered2021.org. Approximately, there are 16 million uninsured Americans who are eligible to apply, and aside from those mentioned earlier, who might already be insured but are still looking for a better alternative. Okay?
Thank you so much, Eliza Gonzalez Manglikmot from Washington. The state of New Jersey drops its travel advisory metrics. Plus, 8 more counties have reported COVID-19 outbreaks in schools. In Sicklerville, May Ann Manzano-Gorzon has the details.
Thank you, Ace. A statement was released from the official website of the New Jersey governor on Wednesday regarding the state's travel advisory. Governor Murphy said that as COVID-19 cases continue to rise at an alarming rate throughout the nation, New Jersey will no longer utilize previously outlined metrics to inform its travel advisory. Given the increased risk of spreading COVID-19 for both residents who travel outside the state and for visitors into the state, New Jersey continues to strongly discourage all non-essential interstate travel at this time. Travelers and residents returning from any U.S. state or territory beyond the immediate region, like New York, Connecticut, Pennsylvania, and Delaware, should self-quarantine at their home, hotel, or other temporary lodging for the CDC recommended period, which is currently 14 days. The Department of Health will issue additional information in the coming days regarding travel precautions. Individuals should continue to abide by the state's current guidance until a new policy is issued. Meanwhile, according to the report of NJ.com, 10 new outbreaks were reported in schools in 8 counties this week, bringing the total to 66 outbreaks involving 269 students teachers, and school staff since the start of the school year, according to the state's COVID-19 dashboard. Citing the privacy of students and staff who tested positive, state officials did not identify the names of the schools with outbreaks or any of the details about how the virus was transmitted at school, despite mask rules and social distancing measures. This week's newly reported outbreaks include 2 in Cape May County and 2 in Monmouth County. There was also 1 new school outbreak each in Camden, Bergen, Cumberland, Mercer, Somerset, and Warren. There were also 2 additional positive COVID-19 tests in Salem County related to school outbreaks that had previously been reported. And as for the latest numbers of COVID cases here in New Jersey, the Department of Health reported a total of 4,073 new positive cases and sadly 50 new confirmed COVID-19 deaths. In Sicklerville, New Jersey, May and Manzano Garzon, Eagle News, we live in interesting times. Back to you, Ace.
Thank you so much, Mayan. Are we expecting a school shutdown in New Jersey given the increasing outbreaks in your schools?
Well, Ace, there are still hundreds of school districts open for in-person classes, and Governor Phil Murphy said that the number of school outbreaks is relatively low as compared to this number. So this statistic is what he used as one of his reasons why he's not calling for a statewide school shutdown yet. So it's not happening, Ace, but the number of public school districts announcing a switch to all virtual classes has been growing each day. Ace?
So 100% in class. That's very surprising, given that there's an increase in the cases. There's a surge right now. I hope the state will also consider, sending them back home, doing virtual classes. Thank you so much, Mayan Manzano Guerzon from New Jersey.
Thank you, Ace.
Like many states across the nation, Pennsylvania is also facing record number COVID-19 infections. In fact, it has reached a critical level. To counter its impact, the state is adding new mitigation efforts. Bureau Chief Mila Simbulan has the details.
Thanks, Ace. With new modeling projecting 22,000 new COVID-19 cases per day in Pennsylvania in December, Governor Tom Wolf and Secretary of Health Dr. Rachel Levine announced new targeted mitigation measures to help stop the spread during this critical time. This includes a robust enforcement plan targeted at chronic violators, along with an effort to ensure schools are safe and in compliance with COVID safety plans. The administration is also encouraging Pennsylvanians to limit unnecessary travel and stay at home. Here's Governor of Pennsylvania Tom Wolf. Take a look.
With Dr. Levine to announce that Pennsylvania is putting into place several new COVID mitigation measures. And I think you all know that the Commonwealth is in a precarious place right now. We have been talking about how we have been anticipating this really big outbreak and upsurge as we got into the fall season and colder weather, and that has in fact happened. We have gotten into a place where we have more cases now than we have had. You have to go back to the early spring. In fact, yesterday we had over 7,000 cases, which is way above where we were even at the worst part of the spring. We have been tracking our hospitalization rate, and that has gone up. We have more people in the hospital now than we had at the high point in the spring, over 3,000. And a lot of things are pointing to, in Pennsylvania, the fact that we are in the middle of an upsurge, and we aren't alone. The rest of the country, in fact, there's only one state where there hasn't been an upsurge, and that is the island state of Hawaii.
In the past past week, the number of COVID-19 attributable deaths has quadrupled, and the average daily case count is 7 times higher than it was 2 months ago. Dr. Levine noted last week that modeling available from the Institute of Health Metrics and Evaluation, or IHME, at the University of Washington projects that Pennsylvania will run out of intensive care beds in December. The IHME's modeling also projects that if mitigation efforts are not adhered to, Pennsylvania could have more than 32,000 deaths from COVID-19 by February 23rd, 2021. That's in just 3 months. With universal mask wearing, those deaths can be reduced by half. Here's Pennsylvania Department of Health Secretary Dr. Rachel Levine to tell us more. Take a look.
Last week, we put into place some targeted mitigation efforts. Today, we are adding additional safeguards for Pennsylvania as we head into the holiday season. As the Secretary of Health, I have issued a series of advisories and orders intended to help stop the spread during this critical time to protect our hospitals, our healthcare workers, and the lives of our fellow Pennsylvanians.
The new measures include revamped school safety attestation, targeted business and gathering restrictions, and a new enforcement plan that includes liability protection for businesses, enforcing the Secretary of Health's strengthened mask-wearing order. The administration is also advising all Pennsylvanians to limit unnecessary travel and keep gatherings held in homes to members of the same household. In Swarthmore, Pennsylvania, Myla Simbulan, Eagle News, we live in interesting times. Back to you, Ace.
Thanks, Myla. What will happen if, let's say, a business is not following the mitigation orders?
So, Ace, if there is a complaint, let's say about a business, the Department of Health will send a warning letter first to the business of the potential consequences, which includes fines and closures if the business is not compliant with the mitigation orders. And if a business continues to receive complaints, it risks referral to the Pennsylvania State Police or regulatory agencies, and of course further fines and possible closure will happen. Ace?
So we're just like what we were discussing earlier, we're relying on complaints from neighbors or competition. Other
exactly,
business.
Yes.
Right, okay. Well, thank you so much, Myla Simbulan from Pennsylvania.
Thanks, Ace.
When we come back, reports from Harrisburg, Ohio, Pasadena, California, and Corpus Christi, Texas. Eagle News America will return in a moment.
Pare, bilisan mo! Mag-alas 12 na! Hey guys, alas 12 na! Tara na!
Excuse me, padaan! Alas 12 na!
You're watching Eagle News America. I'm Ace Ramirez in Washington. Governor Mike Dewine urges Ohio to have a safe Thanksgiving as COVID-19 cases surge, setting records in the state. In Harrisburg, Ohio, Eagle News correspondent Rani Bayuga joins us tonight. Rani.
Thank you, Ace. Ohio continues to set new record highs. Monday set a new high of 11,885 new COVID cases in a 24-hour period. Today, an additional 10,835 new cases alone. Total hospitalizations patients grew to 4,449 as of yesterday. Throughout the summer and early fall, it was at 1,000. The second highest recorded deaths at 156 as of yesterday. New cases are surging so fast that the daily dashboard in the Ohio COVID-19 website cannot keep up to confirm them all. As of yesterday, an additional total of 364 new hospitalizations. Ohio's positivity rating is now at 14%, and 4 counties are now in the public emergency level 4. Franklin County being the first county to hit public emergency level 4 last Saturday, and is now joined by 3 other counties. Montgomery, Lake, and Lorain counties were elevated to level 4, and another 11 counties are on the watch list to be elevated to public emergency level 4. The virus is spreading throughout our entire state and is dramatically impacting all our healthcare zones and their ability to care for patients. Dr. Robert Wiley, MD, states that in his Cleveland Clinic systems alone, 970 caregivers are out due to coronavirus. Some are in quarantine, and the rest are positive for COVID-19. These caregivers are not catching this infection at the hospitals. They are catching them in the community. The drive to drive the severity of the COVID issues, the governor had real people talk about their experience with COVID. People like Jasmine Shaver, a nurse at Dayton Miami Valley hospitals, who described her patients' experiences at the intensive care unit. Respiratory therapist Stephanie Marshall, who was diagnosed with COVID-19. Susan Norvell, who was exposed to COVID and brought it home to her family, and unintentionally infecting all 4 in her household. Dr. Richard Lofgren at UC Health Hospital was quoted, "We're not planning for the surge. The surge is here. We're approaching the point where the influx of COVID patients will displace the non-COVID care." Contact tracings also suggest the new surge can also be attributed to parties done during and around Halloween, and logically, more can be expected from the Thanksgiving holiday. The big fear is if we don't take the message of masking, distancing, and avoiding big groups seriously, Thanksgiving could result in our hospitals being overwhelmed, according to Dr. Bruce Vanderhoff, Chief Medical Officer of the Ohio Department of Health. Thus, the Governor, Mike Dewine, urges this holiday season, let's show each other how much we care by making the necessary sacrifices to ensure we will be healthy to celebrate the next Thanksgiving. Financial assistance to Ohio businesses. Restaurants and Bar Assistance Fund. Restaurants and bars holding permits to serve alcohol are encouraged to apply for the assistance funds. So far, less than half of eligible permit holders have applied. Each permit holder can receive $2,500 dollars, and if they have multiple locations, each location is also eligible. In Ohio, restaurants and bars were ordered to stop serving alcohol by 10 p.m. And now, with the curfew still in effect for another 14 days, they are now to close their doors to customers by 10 p.m. Any relief should be taken advantage of. The Bureau of Workers' Compensation approved a $5 billion dividend to provide financial relief to employers to help during the pandemic. This will bring the total dividends paid out by the BWC to $8 billion. Employers can expect their checks by mid-December. Governor Mike DeWine requested this assistance back in mid-October. This is the largest amount the BWC has ever released and is about the 4th payout this year alone. Perrysburg, Ohio, Eagle News, Ronnie Bayuga. We live in interesting times. Back to you, Ace.
Ronnie, well, what steps has the state done to help ensure that all Ohioans have access to quality care?
Well, you know, Ace, they have prepared a way for all the hospitals to work together, to cooperate with each other during the pandemic. Should there be an excessive amount of people coming in for like they are now, if this gets worse, how will they take care of it? Well, they created a zoning system. Zone 1 being the largest, which spans from northeast Ohio all the way to northwest Ohio. Primarily the large cities in Ohio are there. And this also, Zone 2 is mid-Ohio to southeastern Ohio. And Zone 3 covers Western Ohio, southwestern Ohio. So what they do, the intent is to have all hospitals cooperate with each other to handle the pandemic. And there are two criteria. One is the capacity of the hospital. So if a hospital is small and it's full already, they can move their patients to another hospital and there shouldn't be any problems. Usually the hospitals would compete with each other who gets what patients. And then criteria number 2 is the capability or the services provided by the hospital. Supposedly, if you have a hospital who cannot provide the care that is needed for, let's say, a critical care is required by the patient, they can move that patient to a bigger hospital that can provide those services. So there's all kinds of plans already in place to handle a huge crisis for the hospitals. They even plan to use college dorms, hotels, and even convention centers, just so that they can accommodate any crisis such as this, where we have a lot of patients coming in. Ace?
Right. Thank you so much, Ronnie Bayuga from Perrysburg, Ohio.
Thank you, Ace.
Due to guidelines regarding COVID-19, Disneyland cancels its 2021 graduation night events. Eagle News correspondent Eli Austria has the details. Eli.
Thank you, Ace. Disneyland announces the cancellation of their 2021 Grad Nite events due to the COVID-19 pandemic. With the onset of the pandemic, education, learning, and graduations transitioned to the virtual platform for many students throughout the United States earlier this year. For many high school students, graduation activities and celebrations such as Grad Nite and prom have been unfortunately canceled due to social distancing requirements and temporary closures of popular Grad Nite destinations like Disneyland resorts. Due to the global health crisis, Disneyland temporarily closes their park doors, uncertain of a future reopening date. Disney states, quote, "The recent released state guidelines related to theme parks put us in limbo regarding a reopening timeline in the foreseeable future, and therefore, we are unable to move forward with Grad Nite 2021. We know how disappointing this will be to the many graduates who are looking forward to celebrating at the Disneyland Resort, and we thank you for your understanding during these challenging and unprecedented times. We look forward to celebrating your students in the years to come." In Pasadena, California, Eli Austria, Eagle News, we live in interesting times. Back to you, Ace.
Eli, are the Disneyland resort parks in California completely closed to the public?
Yes, Ace. Indeed, the hotels of the Disneyland Resort, Disneyland Park, and Disney California Adventure are currently closed and will reopen at a later time. So at present, selected restaurants are at both parks, and Downtown Disney have reopened to offer outdoor dining options to visitors. Due to limited outdoor seating capacity, making reservations in advance are definitely recommended. Ace?
Well, maybe the graduation celebrations can be done outdoors. Well, thanks so much, Eli Austria from Pasadena, California. Today's business news with Bobby Soriano in New York and our virtual roundtable discussion about the season you wish didn't exist. That's next. This is Eagle News America. Stay with us.
Events happen around us all the time, in our community, in our country, around the world. Events that affect people, move communities, or simply inspire us. Interesting events that people need to know. In these interesting times, we continue to be a competent partner in delivering news about these events. Fast, accurate, balanced. Eagle News, because we live in interesting times.
Bobby Soriano in New York files this report.
Good evening. U.S. markets have closed. Here are your latest business headlines. YouTube has suspended One America News Network for violating its COVID-19 policy. YouTube and parent owner Alphabet have been criticized in the past for taking a more hands-off approach at pandemic misinformation. But yesterday, the video sharing platform finally took a stand on the issue by suspending One America's YouTube channel for promoting a false COVID-19 cure. The network has gained prominence recently as President Trump has urged his supporters to get their information from alternative news outlets, as opposed to traditional conservative channel Fox News. Fox has fallen out of the good graces of President Trump after being one of the first networks to call the state of Arizona for Joe Biden during the presidential election. One America's channel will remain online, but it will be prevented from uploading new videos for a week and will have to reapply to YouTube's advertising partner program if it still wants to monetize its videos. Purdue Pharma has formally admitted its role in the opiate epidemic, pleading guilty to 3 federal criminal charges via virtual hearing with a federal judge today. The charges include conspiring to defraud U.S. officials and paying illegal kickbacks to healthcare professionals in order to encourage the writing of prescriptions for the drug OxyContin. The plea deal will carry with it $8.3 billion in penalties and forfeitures, but Purdue will only be required to pay $225 million if it completes a bankruptcy reorganization and shifts $1.7 billion of its assets to a public benefit company that is tasked to combat the opioid crisis. Members of the Sackler family who own the company will pay $225 million to settle civil claims and may still be charged with criminal wrongdoing in the future. Lastly, the Department of Commerce released its findings today on the state of the U.S. economy. According to the Bureau of Economic Analysis, U.S. consumer spending grew 0.5% for the month of October, continuing a 6-month trend that has nearly brought spending back to pre-pandemic levels. However, household income ticked downward with a decrease of 0.7%, to which the Bureau attributed to a decrease in federal aid for households as stimulus programs have begun to run out. Sales of newly built homes decreased as well, but remain near 14-year highs. Initial unemployment claims ticked up to 778,000 last week, the first back-to-back weeks of increasing unemployment claims since the beginning of the decline over the summer. Overall, though, economists see the numbers as a good sign that the recovery is continuing. However, a decrease in consumer confidence, in combination with a surge in COVID-19 infections, may look to halt that progress during this holiday season. U.S. indices closed mixed today after hitting record-breaking levels yesterday. U.S. stock exchanges will be closed tomorrow for the holiday. Reporting from New York, Bobby Soriano, Eagle News. We live in interesting times.
December 21st marks the official start of the winter season, but it's already getting colder and colder every day. Some like it, some not so much. Tonight, let's ask our correspondents if they can eliminate one of the 4 seasons. What would it be and why? Real quick, let's start with Eli. Eli, what season would you purge?
I would say winter. We usually get really good weather here in Southern California, but just the amount of daylight we get during the winter kind of, decides that for me.
Oh, okay, so it's shortened, just like here in the East. Well, yeah. Let's go to Myla. Myla, what season?
Yeah, winter as well. I love the snow, but not the aftermath of the snow. The sleet, the ice, yeah, those are the things I don't like about winter.
Same here. I find it dirty after the first drop of snow. Mayanne, what season would you purge?
Well, Ace, right off the bat, I don't even need to think about it. It's also winter. I can never get used to the cold and all these heavy and bulky garments that we have to wear during the season. It's just not fun. Ace.
Not fun, but you get to model all those winter wear. Rani, let us know.
I'll go with winter also and winter spring because you don't really, just to be different, I'll have winter spring. Yeah, I don't like driving in the snow. I don't like the ice, and I don't like shoveling. But yeah, in spring you kind of no longer there anyway. It's sometimes winter blends into spring also.
That's
winter spring.
That's a very interesting answer, Tom.
Definitely winter, and I grew up in this weather. Just never liked the cold. Hate shoveling snow. Was out there this morning doing it for about 40 minutes. Takes me about 40 minutes to clear the driveway and the sidewalks and everything at my residence. So if I never saw winter again, that would be great. I don't mind watching snow on television in a warm climate, but definitely not living in it.
It sounds like this team can move to somewhere warmer like Hawaii or Latin America.
Philippines.
Philippines, there you go. Eliza, let us know. What season purge if you had to do so?
I would have to disagree with the rest of the team. For me, winter is forgivable, but summer in the East Coast, it has to go. For me, it has to go because they're muggy, they're hot and humid. And during the winter time, you get to dress a little bit. I mean, dress up a little bit, dress up in layers. So that for me is fun. How about you, Ace?
Not to sway all of you, but I really don't like the cold weather. I would rather be under the sun, hot and sweaty, than trying to find a warm spot under the tree or somewhere outside. I'm just not a fan of the cold weather. But thank you so much for sharing, correspondents. Have a enjoyable Thanksgiving. All right. Next week, mental health expert Dr. Sydney Fontenares will join us for a discussion on seasonal affective disorder, or SAD, a type of depression that occurs during the winter months, more popularly known as winter blues. Stay tuned for that. We continue to thank our healthcare workers, first responders, and essential workers with a round of applause. We do appreciate you. That is today's Eagle News America. Thank you for joining us. I'm Ace Ramirez. We live in interesting times.